Factors driving the rise in COVID-19 infections include touching your face with your hands and people not social distancing. Dr. Eldonna Boisson says that by far the most ominous cause for spreading the virus is the release of droplets into the air from a COVID-positive patient.
This disease is mostly spread from infectious persons sneezing and coughing, so by that direct propulsion of droplets from persons. We do have evidence that persons can become contaminated if they touch contaminated objects and then put their hands into their faces. But it is mostly driven by ill persons, spreading usually starting from about a day before they become ill with symptoms up to the first sort of 2 to 3 days afterwards. That's when they are most infectious. And that is really what the outbreak is driven by.
Dr. Boisson explains that the way to move back from community spread, a situation within which this country now finds itself, to the lower step of cluster spread is to step up the level of COVID-19 protocols.
We'll need to try to limit their exposure by not going into crowded places, not going out as much as you can so that you limit exposure. And if you do, physical distance, mask, hand washing, and so forth, to limit your exposure, to reduce the number of new cases, to reduce your contact with cases so that the numbers come down. And then eventually when the numbers come down, the idea is that now you have it down to low numbers where you can detect if you have cases popping up and you can shut them down.
And the doctor makes it clear that the problem affects not only health but economics, which, if not handled properly, can exacerbate the problem, leaving people and the country unable to finance battling the pandemic.